There we go. Hello, I'm Eric Baxter.
I'm Molly Calvo.
And I'm Sherry Burnette-Taylor.
And I'm Karen Trevellick, and we're doing our presentation on prison nurse.
And I'm going to start talking about what do prison nurses do. There's four main things that a prison nurse does as far as tasks. They are intake screening, sick call, medication administration, and managing chronic conditions. With an intake screening, that's what it sounds like. Every person that comes into the custody needs to be evaluated for trauma, for suicidal ideation, for infectious disease, even for chronic conditions. So it's a very important thing that prison nurses do. The next thing they do is a sick call, which is kind of the prisoners have a complaint or a medical complaint, and so they will usually in writing request an appointment with the nurse for whatever minor ailment, and even if it's major, you've got to start with a prison nurse. So they come in, and the prison nurses they're allowed to give over-the-counter medications, like if you're constipated or you have athlete's foot or something like that. And then also, if the nurse assesses them and decides that they need the next level of care or they need to be seen by a specialist, then they would initiate that as well. And then managing chronic conditions. Some people are there in jail for a night, sometimes they're there for a lifetime. People are people, they still have high blood pressure, diabetes, asthma, etc. So then prison nurse is part of the team to help manage that. I mean, obviously a healthcare provider would write prescriptions, etc. But the prison nurse does a lot of education and making sure the medication is complied with. Speaking of medication, the other major thing that they do is medication administration. Obviously, being in a controlled environment, medications are all locked up, and the nurse will usually go to each unit and pass the meds at that, to the prisoner in their cell, or the prisoners will come to the infirmary and get their little cup and move from there. So that's kind of the main four things they do. And also within that, the scope of practice, the most important thing to remember is that they're working in a system that's not medical primarily. It's for the security and the safety of the public. So I have to work within that system, within those constrictions. And then obviously their practice is incarcerated individuals for whatever reason, and so they are like the general population in that they get sick just like everyone else, but there can be a higher incidence of sexually transmitted diseases or mental issues, etc. And then also, like I said before, if there's something important that needs to be taken care of by the next level up, then the nurse would be responsible for initiating a transfer or a referral to a healthcare MD or a nurse practitioner, etc. So that is what nurses do and what the scope of practice is.
I discussed actually my research was on the education required of the nurses to work in the facilities of either a prison or a correctional facility. RNs, LPNs, BSNs all can work at the facility. It does require specific training. The LPN's education is suitable to work in the environment. However, they do need additional training. Was it really clear as to what that training was in my research? I'm assuming like any of the facilities, like the hospitals and stuff that we do, they are required to do a 30-hour training for IV, and especially working in the environments that they have to give certain medications inside the prison. They would have to be qualified also to give the IV medications. The LPNs, of course, work directly under the supervision of an RN. The RN can be an associate's degree, but they do prefer a BSN in most states. Licensure is maintained the same way we maintain our licensure within our state CEUs that are required by the state themselves. State of Florida, of course, is 24 CEUs. And then, of course, clinical experience. The nurses need clinical experience, but again, it was not clear as to how much clinical experiences they needed. It wasn't really a time frame that was there. It just said it was preferred. Also, to working in a emergency room was also preferred, just because they do get into medical situations that are urgent, and treatment needs to be urgent, and therefore they need the support of someone that has that clinical background. The other additional training that the nurses are required to have within these facilities is of safety and security. And that is determined once the nurse is hired for the correctional institution. At that time, they send her for additional training to manage that part of it. The other thing that they would like to have, it's not really a requirement, but it just kind of shows that the nurse is knowledgeable and skilled within the correctional facility, is certification. And the certification for a correctional institution is National Commission on Correctional Healthcare, or NCCHC. And that is the nurse, to obtain that, she actually has to have 2 years of experience working in a correctional institution, have 2,000 hours of service within that 3 years before she can even apply, and she can't have any infractions, of course, on her licensure. Once she obtains that, she submits an application, and then once she is qualified to get that certification, and then she has to maintain that with 54 hours of clinical CEUs, and 18 of those have to be regarding the correctional health care itself. And that's within a 3-year period.
Excellent.
Okay, I did my research on the teaching and learning strategies. When the information is collected at the time of the inmate processes, as Eric was talking about, basically the nurse can gather the health information, the health history, as much as the inmate would know, and their family history, and as well as their behaviors before they were incarcerated, such as the drugs or the abuse and violence, family history like the diabetes or heart disease, etc., so they can be monitored and assessed for that. There will be an individual health plan created for each specific inmate. The nurse will use the health plan to teach the inmates, and they'll use it for follow-up and monitoring as their care goes on. Immunizations are also important, so the nurse will also get the immunizations caught up. It could be the very first time that an inmate has had a checkup. It could be the first time that they've had contact with healthcare at all. So there's a lot of education the nurse is going to have to do. They'll get tested for diseases. They'll receive a full checkup. There'll also be counseling available. And so the nurse will, they'll see every inmate that comes through, just as Eric has said. And for each intervention that the nurse has with the inmate, teaching a piece at a time, evidence has showed it's been more effective for their well-being. The teaching that the nurse would do is based on their language, their culture, developmental level, and basically their style of learning. So each inmate will have their own individualized education. And according to the NCCHS, the National Commission of Correctional Healthcare, the standards for the health services emphasize on self-care, preventing diseases, choosing a healthy lifestyle, and encourage it once they're, I would say, discharged, but once they're released from the prison system, that they would have learned the education of how to follow through and have a healthy lifestyle. The correctional nurse will see every inmate when they put in a request, and when they see the inmate for whatever healthcare reason they choose, that gives the nurse the opportunity again to throw in little bits and pieces of education of the healthcare and, you know, emphasize the education. And they promote and encourage the healthy lifestyle. And so the improvement of the well-being for the inmate is where the nurse wants to focus. And just small bits and pieces can go a long way for these inmates. It's their first, you know, meeting with a nurse, medical care. They might see how healthy they can be. The goal is to educate the inmate for them to maintain healthy behavior, as I said, during incarceration and after. Reinforcement and simplicity are the most important principles when providing the education for the inmate. We don't want to throw a whole bunch of information to them at the same time, all at one time. You want to break it into pieces, because most of the inmates that are in the system have their own issues. So they might, you know, have done a lot of drugs or abuse, so their learning could be a lot slower than the average person. So we want to like just keep reinforcing all throughout the entire inmate's time. We got to start with the most simplest topic, and the best thing to do is to discuss the simplest topic and move to the more complex. And then once you're finished with the conversation at the end of the interaction with the inmate, you want to reinforce the first part, the simple, so that way that part will most likely stick with them in their memory. The nurse has to be very concrete when explaining to the inmate. They need specifics. You have to be just very straightforward, concrete, to tell them what you need them to do and what you want them to do. And then, as we would do with a patient in our regular hospital, you want to encourage have the inmate patient teach back, so that way you know that the information is being reinforced. And provide written and orally. We don't know how they're going to learn. We don't know their levels. So, and that's my teaching and learning strategies.
Excellent.
All right, professional interactions. As a prison nurse, you're going to be interacting with all the inmates, securities, probation officers, correction officers, multiple other colleagues in the medical field, physicians, psychiatrists. There's a few different nurses in prison nursing, like nurse educators, as well as psychiatrists, nurse sometimes. So the prison nurse will be collaborating with everyone to give the prisoner the best care that they deserve while they're in. And it's hard for the prison nurse to be able to sometimes see them as somebody who needs health care needed, as well as knowing to a point why they are in there to begin with.
Sure.
All right, so abilities acquired. The prison nurse needs to have very strong communication skills along with personality, good listening skills, also being very firm with what they're saying, because the prisoners can be very manipulative, so they need to know who is sick and who's just trying to hang out in the medical area for a little while and probably maybe trying to steal some tools. A couple other things, some conflict management skills for part of communication. You know, there could be verbal abuse going on, some other conflicts that the nurse is gonna have to deal with on her own terms with either inmates or other colleagues. It is a high stress area and also very high risk. Necessary skills. So the nurse is going to be performing skills in situations that in most nursing departments you wouldn't do all of these things. So the nurse will be being the primary care provider, doing head-to-toe assessments of your ears, doing EKGs, being able to interpret somebody who has chest pain, performing the EKG and actually being able to read it. Having somebody every inmate who walks in needs to be tested for TB. The nurse is going to be administrating the TB shot and then also reading, interpreting those results. Another thing is inmates may be having splints, casts, broken arms, fractures, so they're gonna have to be able to know how to assess those skills.
Let's move on to what we learned about prison nursing. Let's just briefly, why don't everybody say what they found interesting about researching this topic. I can start. I just say that it was interesting. I have worked with prisoners before, and so some of the stuff was familiar, but it was very clear that you need to know a little bit of everything, and it's really only for the right people. And if you're the right person for the job, you really shine.
My part of it was after doing the research, and we really didn't highlight the financial part of it, but I've never really personally wanted to be in the correctional part of nursing. However, looking into the financial portion of it, nurses, for what they go through in the correctional facility, what they make is, to me, not worth the risks that are involved. So I found that very amazing, the lack of income that they made for what they had to endure.
Absolutely. Karen?
Basically the same thing. I was, as I was doing my research, and I actually did want to be a correctional nurse at one point, but as time has went on and I see how society can be, and I feel like it's probably not for me. I think I want to be around for a bit to see my grandchildren grow up, so it's too dangerous for me.
Absolutely.
But
Alright, so I had learned kind of the risks that go along with it, kind of agreeing with everybody else.
Well, you agreed with everybody else.
Right,
So.
okay, so a big thing that caught my eye was that you won't always have security with you as you're supposed to. So you'll be escorting the prisoner back to their cell alone. It just has red flags all over it, and they're just everywhere at some point in the medical field is understaffed.
Indeed. All right. Thank you.